Hi everyone, welcome back to my channel. My name is Rahma, and in today's video we are going to go through how to set up a question bank on AMBOSS, and we're going to solve a couple of questions together so that you can see what the platform has to offer and some of the tips and tricks that I have for you when it comes to solving some questions. So the first thing you're going to do is you're going to log in. If you don't have an account and you're still on the rocks regarding which platform or qbank you want to use, you can also do a 5-day free trial to just get a feel of the AMBOSS platform and its qbank to see if it's the right fit for you. So go ahead and log in. When you do, you're going to see your dashboard. You're going to click here and you're going to go on the left-hand side and you're going to click qbank. Then you're going to select create qbank session, and then I'm going to show you how to set this up, okay? The first thing is to select the exam, and the first thing you're going to see is there's a variety of exams you can select. For this video, we're going to do step 1, but you can already see that you can use this qbank for step 2, step 3, clinical shelf exams, etc. I have a couple of friends who have used this to study for their Canadian exam, their Egyptian exam, the EMLE, and they have also used it to study for the iPhone exam. So you can see it's a very versatile qbank, and I think, from my opinion, you're getting a lot more for your money compared to other qbanks that are just limited to a particular exam. The next thing you're going to do is you're going to select systems. So we're going to go down here. We're going to select respiratory system. You can obviously see that all the systems are available for you. If you want to study like by reading a chapter and then solving the questions for that chapter, you can do that. The other way that you can also study or make a qbank is by discipline. So I found that sometimes in my study, I was aware of particular areas that I really needed to improve on. Say, for example, you know that anatomy is your weakness. So you can also select anatomy as your discipline, right? So say you don't want to do systems. So let's just put nothing for systems here. Let's unselect or deselect respiratory systems. Say I just want to focus on anatomy. Okay, anatomy is my weakness. It's not my strong point at all. So say that's something that you want to study and refine. You can go there, and you can see on the bottom here, you can see the question count is that AMBOSS has 253 anatomy questions. So if you want to sit in one go and do them, you can do that. Say you just want respiratory system anatomy, you can do just that. You can select respiratory system and just anatomy, and you can see that there's 4 questions that they have with respiratory anatomy. But again, for this video, we're not going to select any discipline. But again, if this is something that you're interested in, you can sort your questions based on discipline. For me personally, I have used this to study just anatomy, to study behavioral sciences. You can see their list of disciplines is rather extensive, so you can see behavioral sciences there. Say derm is your weakness, you can select derm, emergency medicine, family medicine, genetics, gynecology, histology. I have used it for histology as well. I had done a self-assessment. For some reason, it was telling me I was weak in histology, so I just sat down and I did like the entire block of histology, for example. I've also used it for legal medicine to just, cement that area for me. So again, it's really convenient if you want to do by discipline. The other thing that I found to be really nice is articles. So if you know a specific topic that you are weak in or you want to improve in, you can also set a certain number of articles that you want to have questions for. So say you're studying respiratory and in your mind, you're having issues with sarcoidosis, for example. So what you're going to do is you're just going to search that there, and then you can select sarcoidosis, and it will only question you on sarcoidosis, right? Say you're having issues, you're studying micro, and you're confused between leprosy and CB. So you can select leprosy here, and then you can also select tuberculosis, for example. So you can select multiple articles. So if we click done, you can see here it will only question you on articles in leprosy and tuberculosis, for example. Okay, so I found that articles to be really nice if you know very specifically which topics you're having issues with. You can definitely focus and hyper-focus your qbank in those areas, which I found to be super convenient and really nice. I don't know how to unselect this now. I have to find them and unselect them. Let me find this so that we can just do a, wait, I didn't actually select that. So we can do this qbank together. Let me just unselect tuberculosis because we just want to do general respiratory system together. Next thing you're going to select is difficulty. So difficulty is 1 hammer and maximum 5 hammer being the most difficult and 1 hammer being the least difficult. So if you're just starting off, I would recommend you just do 1, 2, 3 hammer questions. That would kind of like cover the basic foundations. I find that 4 and 5 hammer questions are a lot more challenging, and I found them to be actually a lot more stimulating mentally. They're really interesting. You can see that there's a lot of steps involved to get to the answer. 5 hammer especially, you can see here that they even say you can challenge yourself now or save them later to boost your score. I really enjoyed the 4 and 5 hammer questions actually. Like I said, they are very interconnected with other systems or other topics, so you can also see the tricks. Like if there is a super tricky question that, especially those, what are they called? Bait and switch type of questions, you'll see them in the 5 hammer. If it's something that's starting off in a particular direction, but the question actually wants you to focus on something else, you'll find those examples in the 4 and 5 hammer questions. So they are definitely really, really nice. But for the sake of this video, I'm going to just do 1 hammer, 2, 3 hammer. That's kind of like if you just want to dip your toes in the water and see what life is like on this qbank. Okay, so let's stick to 1, 2, 3 hammer questions. You'll see here that you now have to select the number of questions that you actually want to do in this block. So most qbanks will cap it at 40. AMBOSS is really nice because it doesn't do that. So if I want to do all 68, I can select all 68 questions. And I found that that's really convenient because there are times where I just wanted to sit down and do a whole bunch of questions for a particular topic without having to go back and do another qbank and set up another qbank each time. So I found it was really convenient for those times where I just wanted to sit down and just do a whole bunch of questions all at once. But again, most people like to stick to 40 because that is how the exam works. But if you find that you are in the situation where, like say for example, when I was studying anatomy, I was like, okay, I just want to sit down and do all 300 questions. So I just made a qbank with all 300 questions. So if that's something that you want to do, you can do that on AMBOSS. But for the sake of this video, I'm just going to do the 40. Then you're going to select the study mode or exam mode. So exam mode will take you to the exact same platform that looks just like the exam itself. So you would do your 40 questions, no breaks, nothing, all at once. You will not see if you answered correctly or not, and then you're going to get a score report at the end. Or you can do start study mode where you can kind of learn as you go. So for the sake of this video, we're just going to do start study mode. Now you're going to see here is your question. It is being timed so that you can see how long you're taking to answer. And just like any other qbank, you can highlight, you can do exclusions if you wanted to exclude answers, things like that. So let's answer some questions, and I'm going to give you some tips and tricks. The first thing is to recognize that a qbank is a tool to help you learn. Okay, you're not going to feel bad if you answer something wrong. If anything, you should use that as a learning moment. See, why am I getting this wrong? What is the correct answer? And you have to learn from that. You should not be intimidated by any qbank. I think for me, one of the regrets during my entire study process was not using a qbank earlier during my preparation period. I was kind of shy towards that and focusing on reading first aid endlessly without realizing that your study tool, your number 1 study tool, is a good qbank. So for that, that's the first thing I want to tell you, is just to see it as a learning tool. It's not there to hurt you. It's not there to lower your self-esteem. You're not supposed to feel bad if you answer any questions wrong. Okay? Let's try to answer these questions. The second thing I want to tell you is you need to hyper-focus on what is the question at hand. Okay, and the way to do that is to do the 2-sentence method, which is something that I used and many people use. Okay, you want to read the last 2 sentences because sometimes in the exam you might find you're getting a very long question. Okay, by the time you read that and you get to the question, you're going to realize, oh, wait a second, what am I supposed to be looking for? And then you have to go back and reread that question in order to be able to answer that. So you're going to save yourself a lot of time and a lot of stress and anxiety if you just know what you're looking for by looking at the question first. And it also saves you from those switch and bait type of, or bait and switch type style questions where they're luring you in one direction but they want you to go into a different area. So as long as you're starting off, you know what it is that you need to be looking for, you won't be tricked like that. Okay, so let's read the last 2 sentences. Okay, the first thing it says is treatment with a low dose inhaled mometasone is initiated. Okay, which of the following recommendations is most appropriate to prevent complications from this treatment? I already know without reading the rest of the question that perhaps it's likely a low dose inhaled. I'm dealing with a case of asthma potentially. So I already have something with me that helps me think of what else I'm supposed to be looking for. So I know for a fact I have a drug that I'm dealing with, this corticosteroid that's inhaled, and I'm looking for complications. I can answer this question without needing to read the rest of the clinical vignette. There are moments where you will realize this, okay? So for example, I would say, which of the following recommendations is most appropriate? We can see to use this 3 times daily, pantoprazole used prior to meals, minimizing use of a spacer, oral rinsing after medication administration, weight-bearing exercise 3 times weekly. Well, I know I'm dealing with a corticosteroid. Again, I haven't read the rest of the clinical vignette. I know that from my studies, a corticosteroid, if I'm using that and inhaled, we can increase the risk of an oral fungal infection, candidiasis. So you want to do a mouthwash to prevent that. So I can, without reading the rest of the answers, the rest of the question or the clinical vignette, answer the question then and there just by reading the last 2 sentences. So that's why it's super convenient to do that, because you will definitely see those moments. But again, during your exam, you don't want to really do that because there might be something else that you want to be looking at, but you can already tell that it saves you a lot of time and energy. So I could select this as our answer right now, our hypothetical answer as what I want to select. Let's just go back and see what else we can do on this platform. So in this qbank, you can also exclude. So say you're stuck and you don't know what the answer is, but you are aware of what is not the answer. So you can definitely exclude, just like in any other qbank. You just click the X over here to exclude that particular answer. If you're stuck, you can also do select attending tip, and it will give you a clue that kind of helps you into figuring out what is the correct answer. If you answer correctly, it doesn't really count it as incorrect. It counts it as correct with help. But if you answer it incorrectly after getting the attending tip, it will still count it as wrong in your statistics. Okay? So we're not going to use a hint here. Let's just go back and read the rest of the clinical vignette and see if there's anything else that we've missed. So we have a 10-year-old boy. He comes to the physician for follow-up. That's something you really want to do, is always highlight the age and the gender of the person in the clinical vignettes. He is diagnosed with asthma 1 year ago and uses albuterol inhaler as needed. His mother reports he has had shortness of breath, so the albuterol is not working well for him. Now he's given the inhaled mometasone. So for me, the answer is going to be to prevent complications of this treatment, let's do oral rinsing after medication administration. Okay, and that is the correct answer. You'll see that in green. Let's read the answer. It says oral rinsing after inhaled steroid use is the most appropriate recommendation. In bronchial asthma, the use of inhaled glucocorticoids such as mometasone results in more targeted steroid delivery to the lungs. So again, now we're getting some information. We do that so that we can target just the lungs in particular, so we have less systemic absorption. It's giving you all those nice factoids and all of that information. However, some of the drug is deposited in the oral cavity, which predisposes the patient to a local opportunistic fungal infections, especially candidiasis. Okay? Gargling or oral rinsing immediately after inhalation is recommended to reduce the local steroid burden and decrease the risk of infection. So for me, that's more than enough information. You can go back and read these other things to see what is the reasoning behind that, to learn from that. For this video, I'm probably not going to do that too much because I don't want to waste a lot of time. But we can see here what are the potential other options. Like this one's weird. Pantoprazole helps reduce gastritis. However, gastritis, okay, the amount of inhalational steroids that is swallowed and enters the GI tract is generally too small to cause gastritis. Again, you can read that if you want to. There's just a point in your studies where you just want to focus on answering correctly and maybe read 1 or 2 incorrects to see where the logic is. But this is a pretty straightforward question. Okay, so that's what you would do. Let's just take a look here. Like, say you're stuck on bronchial asthma. You don't know whether or not to do albuterol or corticosteroids or all these efirulicas and montelukast and the IgE stabilizers and all these things. You don't know what to select, and you're just confused with bronchial asthma as a whole, and you just want to refresh yourself on bronchial asthma. The nice thing about AMBOSS that I really, really love is that it has everything on it. So let's just say you want to learn about bronchial asthma and take that moment in your studies to just refresh yourself on that. All you have to do is hover over bronchial asthma and it will take you to that section in their articles, okay? So you can expand all sections up here. You can read the summary on bronchial asthma. You can see what are the definitions, the epidemiology, the etiology, the pathophysiology of it. You can sit down, you can definitely read and refresh yourself. If that is something that you need help in learning again, and just like something you've forgotten about, whatever it is, it's really nice that everything is on this platform. I don't have to open up another tab. And for me, that helps because I tend to go on tangents or to go down rabbit holes with particular subjects. And when you're studying for an exam, you want to learn not to do that and just remain hyper focused on one or two resources at most. And the fact that AMBOSS has everything for you then and there, again, makes it really, really good, and you're getting the most out of your money in that regards. Okay. Again, you're going to see here the clinical features, the diagnostic procedures of it. Again, I really like these areas here where you can see a normal FEV1 in a patient who is symptomatic at the time of testing makes a diagnosis of asthma less likely. They have these little jewels that you can kind of just remember that really help you overall as you continue to learn and use it in your learning process. Again, you can see everything. What are your findings? You have here your Kirschmann spirals. You can see very clearly the images are very nice. There's also sometimes, I'm not sure if, yes, finally. This is something I really, really love about AMBOSS. So here you're going to see the charcoal-laden crystals, and you can see here on the side the caption. So what it says is the lumen of the bronchus is filled with mucus and inflammatory exudates. This structure is known as the charcoal-laden crystal, a histopathological finding in patients with eosinophilic inflammation. Okay, so say I'm just looking at this, but I don't know what I'm looking at. Where is this crystal, or what exactly is it that I'm supposed to be looking at this, in this microscopic image, right? The nice thing about AMBOSS is you can select overlay, and it will tell you exactly where to look. I've used UWorld before, and there are times where they will point with an arrow to a particular section, or sometimes give you an x-ray, and sometimes I'm still looking at it. I'm like, what am I supposed to be looking at? I really like the overlay. It might seem something like it's simple, but it saves you a lot of time because you know exactly what you're looking for, especially since pathophysiology and histology is such a huge part of the exam. Just familiarizing yourself with what it is you need to be looking for and getting your eyes used to it is really useful. So for me, I really love the overlay option. You'll see it whenever there's x-rays, whenever there's things like this, CT scans, MRIs, so that you know exactly what you're looking for, what you're looking at. And I think that's super convenient. So again, like I said, you can also continue reading that if you wish. You can click close here, and it'll just take you back to the main the main question. And there's also this. So this is also nice as well. So again, you need a quick image of the adverse effects of glucocorticoids. You can go through this in a second, and again, you're learning as you go. You're not being tested. You shouldn't feel bad if you answered this question correctly. It's just nice. So I need a refresher on the adverse effects of glucocorticoids. So as I'm studying, I'm gonna be like, okay, insomnia, cataract, glaucoma, that's important, moon phases, inhaled glucocorticoids, you have the risk of oral candidiasis, you have the hoarseness, respiratory tract infection, you have truncal obesity, your stria, your poor wound healing, that's important, your myopathy, that's important, skin atrophy, thinning. They also have the other adverse effects on the immune system. This is super important: neutrophilic leukocytosis, immune suppression, abdominal organs. You're going to have ulcers, hyperglycemia, hepatic damage, all of these things. So again, it's really nice. You have these images, you have these x-rays, these histology pictures, the overlay that's on them. So it's a whole learning process. It's not just questions and answers and that's it. So you're definitely getting an experience, and it feels, to be honest, very fun. I really enjoyed using AMBOSS during my study period. So let's again move on to the next question, and let's do the same technique where we are going to read the last two questions, sentences, to help us get to the point, essentially. Okay, so here we see left ventricular ejection fraction is 60%. Which of the following is most likely underlying cause of this patient's condition? Okay, so I'm dealing with somebody who may have like some heart failure. Since we're talking about ejection fractions, not so low yet, it's like 60%. So let's take a look at what the answers are. What is the most likely underlying cause of the patient's condition? Is it excessive systemic collagen deposition, left-sided systolic heart failure, a ventricular septal defect, chronic occlusion of the pulmonary vessels, chronic hypoxic vasoconstriction? Let's go back and see if there's any clues that can help us figure out what's going on here. 57-year-old man, like I always said, always highlight the age and gender of the patient in the clinical vignette. He has COPD, comes to the emergency department because of leg swelling for 2 weeks. He has smoked 2 packs of cigarettes daily for the past 20 years. His vitals are within normal limits. Physical examination shows jugular venous distension, hepatomegaly, pitting, edema of both lower extremities. So we're looking at very classic symptoms of heart failure. Cardiac examination shows regular heart rate and normal heart sounds. Auscultation of the lungs shows scattered wheezing without crackles. okay, without crackles. I'm going to highlight that. Left ejection fraction is 60%. Which of the following is most likely underlying cause of this patient's condition? So his condition is heart failure. So let's do this by process of exclusion. I don't think he has excessive systemic collagen deposition. Left-sided systolic heart failure, VSD, I don't think so. I think he would be much younger than the 57. Chronic occlusion of the pulmonary vessels. Vessels, no, I don't think so. Might be wrong, I don't know. Chronic hypoxic vasoconstriction. I'm gonna go with that as my answer. His ejection fraction is not low enough for me to select heart failure as the main issue. I think he's having, because of his COPD and his smoking history, that hypoxic vasoconstriction, which is causing that heart failure. So that is the correct answer. So this patient's right-sided heart failure is most likely due to chronic hypoxic pulmonary vasoconstriction, like we said, due to his COPD. Okay, so we've answered this question correctly. You can see the attending tip up here. It tells you hepatomegaly, the edema, the JVD are consistent with right-sided heart failure. Chronic untreated pulmonary hypertension puts the strain on the right ventricle, causing the concentric hypertrophy, the progressive decline in right cardiac function, eventually leading to symptoms of right-sided heart failure seen in this patient. Again, if you wanted to do a refresher on pulmonary hypertension, you can hover over it and just see a couple sentences on it, or you can just select it and it will take you to that section and you can read it over there. Okay? Again, let's expand all sections just to see what that looks like. It will also link you to a couple of videos if you want to watch them on, I think that's Osmosis. You can see the definitions, everything here, all the important things you need to know. I just want to see if there's any x-rays here that we can look at so I can show you the overlays. Again, you'll see the pictures. Again, they're very clear, they're very nice. You have a nice caption here. Let me just see if there's any overlays. Like I said, there's no overlays here. You have your ECGs, S1, Q3, 2, 3 for that. Again, just looking for an overlay for you guys. So here's pulmonary hypertension. How do I know that this person has pulmonary hypertension? I do know that it is like increased vascular markings. So here you're going to see that they've highlighted this in the overlay. We have, what are we looking at? Regular diaphragm, enlarged left auricle over here, and left atrium leading to a loss of cardiac silhouettes, dilation of the left pulmonary artery in this P section here, so you can see very clearly what you're looking for, what you're looking at. That's super important. Extensively enlarged pulmonary arteries in the marked area over here. So these are enlarged. Again, the overlays are super precious, honestly. I think they are an incredible learning tool. Again, you can see here the overlay that you're looking for. Decreased retrosternal space due to hypertrophy of the right ventricle. Okay, so here's the right ventricle. That's how I know it's hypertrophy. That's what I'm looking at. The left atrium as well. Left atrial enlargement. So again, it's incredible, like the learning that you can get just out of one platform. I just think it's really nice. Like everything's there. I don't need to open up a new tab and look at x-rays of pulmonary hypertension and what it is I'm supposed to be looking at. It's all there. Okay. Next question is again, let's read the last two sentences. A photomicrograph of the specimen obtained on pulmonary biopsy is shown. Which of the following is most likely pathogen? So we're looking for a pathogen. Okay, you can skim through with your eyes very briefly. Okay, what are we looking at? Let's take a look at this. It's not going to show you the caption if you haven't answered the question yet. But you will see the overlay of the pathogen. So I'm seeing what looks like acute angled hyphae. So we're looking at a fungus. Okay, so let's remove TB already without reading the rest of the clinical vignettes. I'm going to remove TB. I'm going to keep the rest of these guys and just see what's up. 64-year-old man is brought to the ER because of fever, chills, shortness of breath. He has metastatic pancreatic cancer and is currently undergoing polychemotherapy, so he might be immune suppressed because of that. His temperature is 38, so he has a fever. Pulmonary examination shows scattered inspiratory crackles in all lung fields. CT shows multiple nodules, cavities, and patchy areas of consolidation. A photomicrograph is shown. So what could it be? I'm gonna take a guess that it's Aspergillus. Okay, photomicrograph of this patient's pulmonary biopsy shows narrow septate hyphae branching dichotomously at 45 degrees, so I said it's an acute angle. A galactomannan antigen detection assay would be positive. That is something I would definitely put in a note in first aid, because I know for a fact it's not in first aid. You need to know this galactomannan antigen detection assay. Okay, would be positive in this patient's serum. Say I want to learn about Aspergillus fumigatus. All I need to do is click here, and I can just do a good refresher for me and read it through. So let's take this second to just read through and expand the sections and just see everything, because sometimes I tend to forget about Aspergillus. There's so many fungus that can affect the respiratory system, so it's good to make sure you've hammered down Aspergillus, your TBs, your Candida, those guys. So let's see what it says here very briefly, just so you guys can see. You can also, I think, move this over a little bit. Okay, let's read and see what it has to say. We have Aspergillus is a genus containing over 200 species. What's really nice is in bold, you'll know what's important. What's in these little green boxes or red boxes is something that's really important. So you can instantly tell what's exactly that's high yield for you to know. So let's just go through Aspergillus very briefly. So Aspergillus fumigatus is what we're looking at. The transmission is airborne. We have Aspergillus spores. They can settle easily on accessible sources of nutrition, water, dust, cellulose, and indoor plants. Aspergillus spores can be found in ICU. Risk factors are severe immunosuppression. So we know in this case he's on chemotherapy, or HIV, or neutropenia due to chronic granulomatous disease can facilitate the development of invasive aspergillosis. So I gotta keep that in mind whenever I see these kinds of clinical vignettes: HIV, immune suppression, CGD. Then we're gonna go with Aspergillus as one of our. You gotta keep that in mind as one of your answers. Okay. Destructive pulmonary pathology can lead to chronic pulmonary aspergillosis. So I look for previous scar tissue. This is super important. Previous scar tissue can increase the risk of aspergillosis, or lung cavities, sarcoidosis, if the patient has sarcoidosis in the background of this, COPD, emphysema, etc. Aspergillus can trigger hypersensitivity reactions in patients with pre-existing bronchopulmonary conditions, asthma, cystic fibrosis, etc. Okay, so that's super important. Again, these are all really good factoids, actually. Clinical features here, they have really nice tables, so you can go through that if you want. To see the different kinds of it. So you have your ABPA, you have your chronic aspergillosis, you have your invasive and what that looks like. We have a pearl here. So we have invasive aspergillosis, mostly affects the bronchioles of the lungs, but can also be a disseminated infection like skin and CNS. Your diagnostics, so what are we going to look for if we're dealing with aspergillus? You might get a super hard question that tells you what you're going to look for. It's not going to show you anything other than the photomicrograph of it, and tell you, well, what lab results are you looking for. If you wanted to take it an extra step, you want to know IgE levels will be elevated, eosinophilia is going to be there, elevated ESR, positive aspergillus antigen test. Okay, chest x-ray, what are you going to see? You have your bronchiectasis. You might see an aspergilloма, a mobile fungus ball, for example. Look for the serology. All these things are there for you. It's bolded. Findings that you're going to see, that's super important, that they are septates, hyphae branching dichotomously at 45-degree angles. These are really important facts. Okay. Again, they'll give you another pearl here. The most important diagnostic for the different aspergillosis types are the IgE and eosinophil count for the ABPA. Your aspergilloma, you want to look for a positive culture and fungus ball that's seen on the chest x-ray, etc. Here we have so many slides or pictures to go through. So what am I looking at here? Again, what am I looking at? I know there's something here. What is that? That's aspergilloma, the fungus ball. Let's look at the overlay. Okay, for sure. I know that's what I'm supposed to be looking at. And then you can read the caption for it. That's super important. What's going on here? Again, I'm seeing, okay, so this is what they were saying. It doesn't have to be just the lungs. It could be the brain. Coronal section of the brain shows a mass in the left parietal lobe. Here again, we got to get those pictures in our mind. Don't ever skip through the pictures. Seeing more pictures helps cement these facts inside your head. You have the acute angles, the septate hyphae, dichotomous. I see all of that here. Okay? Again, the same picture. You have to really focus and get these pictures inside your head and just be comfortable with that. Again, we're looking at here, clearly 45-degree angle. This picture is also really important. Here we go. We have an x-ray here. What am I looking at? Let's look at the overlay. They want me to focus there and there. So you can see here where it says within the arrowheads, that is in the upper zone of the right lung, an ovoid lesion that can be seen that is surrounded by a thin rim with normal radiolucency. So over here, that's the normal radiolucency. You can see the black over there very clearly. You can see that. If you just receive this x-ray without seeing clearly what it is or having that overlay, it would be difficult really to understand what you're looking at. Okay, let's see what's inside this red rectangle. There are diffuse reticulonodular opacities in both lungs with numerous large nodules interspersed throughout. So that is what's inside the red rectangle. Very convenient to have that overlay and that caption. Again, here we're looking at aspergillosis. Let's look at our overlay. Very useful. So let's close that. Again, say you want to take this minute to be like, oh my God, I have a lot of stuff to know for pulmonary infections. There's so many things. All of these were potential answers, right? So again, let's just see why this is an answer and why that's not an answer, and take this moment to see why it's also useful to learn from the incorrect answers and kind of use it as a refresher. So why is this not TB? What's going on? It's going to tell you Mycobacterium tuberculosis causes TB, and primarily affects the lungs. Active TB can present with fever, chest pain, dyspnea, productive cough, hemoptysis, and cavitation on chest CT as seen in this patient. So there's similarities, okay? Moreover, immune deficiency in this case is a risk factor for both the TB and reactivation. However, pulmonary biopsy would show something else. The acid-fast bacilli will not show you this. You won't see this in TB. So what are we going to see? Let's take this moment to refresh our mind on to what that looks like, that acid-fast bacilli. And that caseating granuloma, here we go. If we had instead seen this instead of the hyphae, then we would select TB as our answer, okay? So here you can see it. You can see the name of the stain, what it is that you're supposed to be looking for if it was a case of TB. Let's say we're dealing with, well, this patient had what? Immune suppression. Histoplasma capsulatum could be a potential answer. So let's see what it says. Pulmonary histoplasmosis manifests as fever, chills, chest pain, all of which are seen in this patient. However, if present, cough is usually non-productive and hemoptysis is uncommon. So we know that cough and hemoptysis is common with aspergillosis. Although immune suppression due to chemotherapy, as in this case, is a risk factor for both, okay, histoplasmosis is typically seen with exposure to contaminated soil, okay, and this patient's biopsy findings are not consistent with this diagnosis. As a silver stain examination will show macrophages filled with dimorphic fungus. So again, there's lots of fungus, so you need to get used to seeing these things. So here we know that if it was histoplasma, I would look for a macrophage, and inside that macrophage, I would see the fungus that I'm looking for. Again, let's take a second and look at that. So here's what we're looking at, the histoplasma capsulatum. They've given us the mold form of what that looks like. You have this knobby looking, I think this is not the captain's wheel, I think. I'm not sure. But again, this is what it would look like. So you have to get your eyes used to the different kinds of hyphae. So this is not the aspergillus. We're looking at this knobby looking mold form that they're saying here. Pneumocystis jirovecii, let's see what that is. You can definitely use this moment to just refresh everything and solidify all of that information. Okay, so pneumocystis jirovecii, I'm not the best at pronouncing these things. Pneumonia is an opportunistic fungal infection presenting with dry cough, progressive dyspnea, and low-grade fever. Although it occurs most exclusively in immune-compromised, like this patient, what are we going to see that would have made us select pneumocystis instead? Well, we're looking at PCP typically shows symmetrical, diffused, interstitial infiltrates extending from the perihilar region, and a histopathological exam with silver staining with visualized disc-shaped P. jirovecii cysts with central spores. So again, similar things, but what are we looking for? We're looking for the silver stained spores. So you have to get your eyes used to these things. Again, if you don't know what you're looking at, look at the overlay. It's telling you over here, what are we seeing? We have the cysts are, walls are stained black. Okay, cysts are located within the alveoli. So we're looking at an alveoli, and we can see these cysts that are there together with the inflammatory exudate. Let's say we're talking about Rhizopus species. Rhizopus causes mucormycosis. Again, if you forgot what mucormycosis is, you can select that and read that. Life-threatening fungal infection that affects the immune compromised in diabetic patients. So again, I know if it was a diabetic patient, poorly uncontrolled, then maybe Rhizopus would have been the correct answer. Pulmonary mucormycosis rapidly progresses and causes extensive necrosis and infarction with potential spread to the mediastinum and heart. So we're looking at necrosis, we're looking at infarction. Those are the buzzwords that you really want. Say you forgot what necrosis is. You can still cover necrosis as a topic. So you can select this and go through all the types of necrosis as a second to go back and refresh everything in pathology regarding necrosis. So again, you can use this if you're very smart and strategic about it to just drill yourself with facts and factoids and information to just elevate your learning experience in such a way that I don't think other qbanks offer. Okay, I think that's enough for these guys. If you wanted to go through that, you can. Let's try a different question, and this time I'm going to show you guys the attending tip. Okay. Oh, I don't want to show you the attending tip because this is really easy. Okay, so a photomicrograph of the specimen is obtained. So here we have a photomicrograph. The patient most likely works in which of the following fields? If you're smart, you already know what the answer is. You're seeing these dumbbell ferruginous bodies that are seen with asbestos. Okay, these iron-looking dumbbells. Okay, so I know that if we're dealing with the dumbbells, that would be, I think it's aerospace manufacturing or shipbuilding. One of those two. No, berylliosis was aerospace. Shipbuilding, I think, is asbestos. Not cattle farming, not sandblasting, that's silicosis. Coal mining would have been coal workers' lungs. So I can guess right now the answer is just by reading this. Okay? Let me just prove it to you that it actually is correct. So it is shipbuilding, asbestos. Okay? Let's go back and see what's there. They also kind of highlight for you or underline the most important things. You have a 61-year-old man, 9-month history of shortness of breath. He has these crackles. There's digital clubbing. So we know that we're dealing with pulmonary vasoconstriction, all these issues that are happening in fibrosis. Pulmonary functions test shows this ratio. So I'm looking at a restrictive disease because the ratio is still high or normal, and a total lung capacity of 70%. An X-ray shows bilateral reticular opacities in the lower lobes. So there's a reason why they highlighted this or underlined it for you, because asbestos is on the roofs, but it goes to the floor. Remember that? So that you know that the lesions are in the lower lobes. Silicosis, on the other hand, is on the ground, but it likes to go to the roof or to the upper lobes, for example. So that's really important to help you in that moment to get that correct answer. The attending tip in this particular example was what it's telling you is you have a restrictive pattern of lung disease. The photomicrograph shows several dumbbell ferruginous bodies, which are collections of iron and protein coating asbestos fibers. So that should have been enough for you to know what the correct answer is. And that definitely is. So you can see the iron, the dumbbells, they tell you it's asbestos. So you just had to know what he worked as, which is shipbuilding, okay? You can also go here. Again, you can see what it is that you're looking for, a gross micro photograph of the diaphragmatic pleura. So this is what the pleura looks like. White fibrous plaques are seen, so that in case you get a question like this on the exam, you know what it looks like gross and microscopic. You're going to definitely get all that information. If you wanted to refresh everything in your mind about asbestos, you can select that section and read it over. Again, these are really nice, these pearls, or I don't know what they call them, but those blue or light blue or sometimes they're red, they will just attract your attention to those particular factoids that you really want to know and want to memorize. I'm just looking for any other pictures or things that we can see here. So this is all in part of a section of carcinogens. So if you selected asbestos, you can go spend 10 minutes to read this section and just be completely refreshed on all of your carcinogens. So that is super awesome, honestly. I think that's amazing. So you have your general oncology, you can just refresh that in 10-15 minutes and go back to your qbank. So you've done a lot more than you need to really just elevate your learning experience, okay? So you have your shipbuilding here. So we have that. Say we got confused. Like for a second, I'm just like aerospace. It's either aerospace or shipbuilding. And I'm like, okay, so what is it? Say you wanted to know. So we can select that and learn. Okay, so aerospace will be with beryllium alloys, which cause berylliosis, etc. So you can read that. You can see what the berylliosis looks like, and see how it's not the same thing at all with the ferruginous bodies that you would see with asbestos. Cattle farming, what are we looking at with cattle farming? We're looking at molds, fungus, all these things. Sandblasting would be silica. Coal mining would be the coal miners along the pneumoconiosis. And you can see what that looks like. Very clear, very nice images, and very obvious in every way. Let's do one more question. A 62-year-old woman with hypertension and type 2 diabetes comes to... I gotta follow my rule. So last two sentences. Her diffusing capacity is 42%, so it's low. If you study first aid, you know the only thing that does this is emphysema. For example, which of the following is the most likely diagnosis? Should I click emphysema? I'm correct. It's emphysema. Okay. So again, in your real exam, don't do that. You want to make sure that you do all the other things. But I'm telling you, the 2-sentence method works like a charm. Okay. If you just have particular facts memorized, you can definitely overcome the exam by just focusing yourself and saving yourself time. Okay. Anyway, let's go back and do this question properly and read the actual clinical vignette so we can learn. Right. We're not rushing to answer. We also want to use this as a learning opportunity. Okay, a 62-year-old woman with hypertension, type 2 diabetes, comes to the physician because of increased shortness of breath, dry cough. She smokes cigarettes. Chest auscultation shows expiratory wheezes in both lung fields. Her FEV1 FVC ratio is decreased, so I'm dealing with a COPD type of disease. Okay, and her diffusing capacity is low, so I know automatically I'm dealing with emphysema. If it was normal, I would go with bronchitis. Is it bronchitis? What's the other thing? See, brain farts here and there, and sometimes we answer the questions correctly. If it was the other guys, is it bronchitis? Bronchitis? Yes, bronchitis. Would have been normal, okay? Even elevated in bronchitis. So which of the following is most likely diagnosis? We got that, okay? So here again, if you wanted help, you could have selected your attending tip. It will tell you that the ratio is low, so we're looking at a COPD. So figure it out. So if you were stuck and you didn't know, you can also do this by process of elimination. It's definitely not heart failure or pulmonary fibrosis. It could be bronchial asthma, but bronchial asthma typically won't show this, and this can be adjusted with that drug test, which I forgot what it was called. It could be the chronic bronchitis. So let's see chronic bronchitis and see if I'm correct with my assumption. Smoking is a risk factor for chronic bronchitis, which is one of the phenotypes of COPD. Chronic bronchitis can cause dyspnea, cough, wheezes, and features of obstructive lung disease on spirometry. However, chronic bronchitis can only be diagnosed if the patient has a productive cough on most days of 3 consecutive months in a year, and this pattern of respiratory symptoms has been present for at least 2 consecutive years. Moreover, the only point you need to know, DLCO is usually not impaired with chronic bronchitis because there's no structural changes in the alveoli that would affect the diffusing capacity, whereas emphysema, they're completely destroyed. Okay? So that is where I'm going to end this video. If you guys want a particular system kind of to explore that, we can do those. We can do those in like future videos. Just tell me what it is that you guys want to see or any other questions that you have. Like you've seen, it's a really nice qbank, and the method that I've always been advertising myself is the last 2 sentences. It saves you a lot of time. Of course, obviously you want to make sure that you're reading the whole thing, but again, it helps. It helps when you're answering questions. I really like AMBOSS. I've always advocated for it. So if that's something that you want to try, there's always a 5-day trial. I'll put the links in the description for you guys below. Let me know what you'd like to see in the future. If you want to do other qbanks, other qbank sessions, let me know, and I will try to accommodate that and make a future video for you guys. In any case, I will see you guys in the next video. Take care.